This gentleman came in to me as a walk-in. He went to the hospital for MVC, neck injury. They did a chest X-ray, they did a C-spine X-ray, and subsequently found like a nodule at the top of the left apex of the lung. So they moved on to a CAT scan, which did confirm a nodule. So he comes to me in a panic, found this out on his birthday. So I have hospital records. This guy's got no insurance. He is 38 years old, and he has been smoking since he's been 8 years old. So, you know, his demeanor is off-put. You know, he thought like nothing was ever going to happen to him. He's tried patches in the past. He's tried lozenges. Nothing's really worked for him. So now he's just sitting here, melancholy, not really knowing what the next steps for him are going to be. So I have a follow-up with him, I believe, on Friday, but that's pretty much all I know about him so far. Not on any medicines, no other medical history. Blood pressure is a little bit elevated, but he was also very nervous about meeting me. So what do I do now? Go down. Okay. Yeah, like I said, yeah, 30-pack year history. You know, he fluctuates from a half a pack a day to maybe 2 packs, depending on what's going on. He's a roofer. Insurance coverage, he has the ability to have it at work, but hasn't gotten it because he's been otherwise healthy. So this year he will be signing up at open enrollment though to get that, because I told him we will have hopefully it's nothing, but if it is cancer, we will have a long road ahead of us. Physical exam. Oh, okay. So lungs overall sounded not terrible. He did have inspiratory wheezes that cleared with a cough on exam. He does have cough in the morning with a little bit of white sputum production. The CAT scan also shows some emphysemal changes, which is alarming at his age, but consistent with the amount of smoking that he's been doing. So like I said, I've only seen him once. So as I continue to follow up with him, I'll go from there.
Great. That's great, Tiffany. Anything else? Am I interrupting you? But keep going. No,
I'm good. Like I said, I've only seen him one time, so this is pretty much all I got going on right now.
Yeah, that's great. That's great. So let me make sure I'll just summarize quick, and then we can get some clarifying questions and then dive in. This is great. Thanks for this is an interesting case and not unfamiliar, I'm sure, to many of us on the phone. So this is a 38-year-old, otherwise healthy male who has a long smoking history and is smoking a pack and a half to 2 packs a day, and now has a new medical finding with this lung nodule and possible lung cancer diagnosis, although who knows, we'll see, and may have some motivation to quit. And you're just looking for some ideas and inspiration about how you can approach the topic of cessation with him at his next visit later this week.
Yes.
Did I get it mostly right, Stephanie?
Yeah, that sounds right.
Yeah, great. Okay. Anybody have any clarifying questions first? Do you want more information or anything to clarify with Tiffany before we dive into some discussion?
Yeah, this is Frank. Have they done a biopsy on him, and when are the results going to be known?
No, biopsy was not done. Like I said, he showed up at the ER for a neck injury, and then he pops in as a walk-in here. So he has no insurance. We don't have funding for any of those things. So we have a program called We Care. I reached out to them to see if we can do advanced testing. I'm waiting to hear back if they will volunteer their time and services to this guy until he gets insurance.
Good question, and it's tough. The situations are, I don't know, I have nothing to say, because I'm sorry. It's tough, yeah, really tough. Okay, any other clarifying questions for Tiffany?
When is open enrollment for his insurance?
He was thinking it was October or November.
So it's going to be real soon.
Yeah.
So just to stay with that, I think the critical issue, this isn't a clarifying question, but hopefully it's a clarifying comment. We need to see what that lesion is. And you've got 2 pathways. If it's cancer, then you need to talk to the doctors who are taking care of him, because the outcome of both surgery and chemotherapy is much better if people are not smoking. If it's not cancer, this is a wonderful opportunity to say, wow, this is a scare that you had. The next one may not turn out quite as well. So let's work as hard as we can to get you off smoking.
Right, I totally agree. Mm-hmm.
Yeah, great point, Steve. I have one clarifying question, Tiffany. Did you say, has he used patches in the past or not?
He said that he did, but not like in a ritual type of manner. He tried them for a few days, kind of gave up on him. He is a roofer. Again, we talked about he wanted to do the patches because he didn't have to take a pill, but yet they didn't stick on when he was working throughout the day. So he just kind of gave up on them and went about his day.
Gotcha. Okay, thank you. Okay, let's just dive in for some discussion and some ideas for Tiffany on maybe how to start to approach cessation and what might be the best starting point.
So this is Steve again. I think the most important thing is this is an elusive patient. So you need to make sure that you capture him, keep him in the system, and do outreach, because I think there's some chance that he won't come back and see you just based on his previous personal behavior. And this could be a life or death kind of a situation. So setting up systems to make sure that you get him back. And then this is somebody I would go full court press with a combination pharmacotherapy on, because you don't want to lose him.
Agreed. Yes, we have I have a critical patient log that I keep all of my serious cases that I need follow-up on, and I think I'm going to lose in this log. So I have my nurses calling them perpetually to keep them up on their follow-ups. So he's definitely on my #1 list.
That's great.
Excuse me, this is Frank. I'm sorry, but don't get my throat.
You're fine. Mm-hmm.
The reason the patches didn't work is he didn't use them correctly. So that's what I would point out to him. And did you say they didn't stick? Was he sweating a lot?
Yes, he's a roofer in Florida. So.
All right. Okay. All right, well, that makes, so normally if he wants to use the patch, you can just put surgical tape on top of them and they will stay on. But it sounds like that may not be the best option for him, although I agree with Steve. I would have him use the patch and the lozenge, or the patch and the gum, or any combination at this point would work. But you really have to work on compliance. He could put the patch on his, like on his tricep, on someplace that really isn't going to sweat a lot. If he's putting it on top of his chest, that may be the problem, because there's a lot of more sweating up there. So I ask him all those kind of questions, really go into detail with him about that. What I would really focus on is the fact that he's very, very young to be having all these problems. And he's already having these at 38. He's definitely going to have more problems as he gets older. So that's
I totally agree. Yes.
A behavioral thing. But the other part is that if he used those patches, he didn't do anything else. So, we've been emphasizing the whole year that you have to do, excuse me, you have to do behavioral counseling in addition to the medication. So I would definitely sign him up for the quit line, and see if there's any kind of work that he can do with you individually around all the behavioral issues, or if there's some other resource at the hospital that's not going to cost him anything. And I would also point out, if he's a roofer, I just had my roof done, they're using tar and all those other kind of things. So he's breathing in a lot of junk to begin with, and adding the smoking on top of that is really impacting his lungs. So I would really hammer that part, that he's very young to have all this happening already.
Yes, I totally agree. And before that, he was a roofer for 5 years, and before that, he was a painter. So there's more exposure there.
Right. But yeah, really, and emphasize the fact that he needs to do some behavioral changing too. Did they actually do a depression screening on him? Because I noticed in your notes that it says it was negative.
Yes, we did a PQH9 on him.
Okay, because generally speaking, when somebody who is facing a cancer diagnosis and won't quit smoking, my experience has been that they are depressed, and they're using the cigarettes to self-medicate in a way. And that's why they're so reluctant to quit. So I would just keep that in the back of your mind, even though he didn't, he was negative on this screening. There may be some issues there. And one question to ask him, if he's really just completely refusing to do this, is what's so important about cigarettes in your life that you're willing to give up your life for?
Yeah, that's a great question.
Words to that effect, But ask him the question beginning with the word what, because then that's going to prompt him to really explain himself to you.
Right.
That's great. Frank always has the good questions. That's a good one. I like it. To help him kind of think through, like, what is it that's keeping him smoking, even with his health, and recognizing this is sort of all new and an unexpected part of his life recently. I don't know, Linda, do you have anything that you'd like to talk about with the quit line or what might help there in Florida?
Absolutely. And thanks for the presentation. I think Frank had a number of things that were really useful as well. And Steve, the quit line in Florida is a fairly robust quit line with a fairly good budget. So he may, if he calls into the quit line, and I would encourage you to try to make a referral for him when he comes in next to the quit line. They'll provide the behavioral counseling, and most quit lines will provide one type of medication. But they can also talk to him about the idea of combination treatment and why that's important, and especially as a roofer, if he's able to use the patch in the way that Frank described, or, sometimes men will put it on a part of their arm that has some hair on it. And so there can be a little bit of a sticking issue, but if you can walk him through how to use it in a place that maybe doesn't sweat or doesn't have much hair on it, that would be best. But the quit line can also, if he gets, say, patches from the quit line, they can also talk to him about buying gum and how to use gum or lozenges as the second part of the combination treatment. And especially for somebody who's been using a lot and for such a long period of time, having a long and short-lasting nicotine substitute is going to be important for him. The quit line in Florida, or the cessation program, also has face-to-face clinics, if that's something that he prefers. It's a really robust set of cessation services that are offered through AHEC at the state level. And if he's a roofer and maybe starts his job early in the morning and gets off mid-afternoon, the idea of going to a clinic face-to-face may be something that is appealing to him. And I would encourage you to call the quit line before you see him, so you can talk with them about options that are available. And if he does want to use the clinics, where the map is that shows where the clinics are located, so you can just make it a little bit easier for him, that he doesn't have to do work to figure out where's a clinic near me, where's my job site, things like that. If you could pull up the map for him and maybe walk him through that, that might be helpful to him. And I believe if you go to the clinic, you can get the medication right there. If you use the quit line, they usually send it by mail and try to get it to you within 2 to 3 days. So I think those are really, really good options. And maybe talking to him a little bit about, why he might want to quit and improve his life. I mean, he's had this scare. This may not be, the nodule may not be anything life-threatening. It could be, but it may not be. And this is really maybe a good time for him to think about a transition to a healthier lifestyle. And, whether he has a partner or children or, somebody he takes care of, even a dog. We've talked about the importance of pets in people's lives before. But whatever smoking he's doing is harming those folks too. In some of the trades where you're outside and, mostly around other guys who might have the same lifestyle as you, it can be really challenging to try to quit because you don't have the policies, the non-smoking policies, like pushing you to think about quitting. And you might not, you might be around other smokers. So maybe talk to him a little bit too about when does he smoke, how does he smoke, who he smokes with. If he's smoking with the guys he works with, it's going to take different strategies to really walk him through what it's going to take not to be around smoking and not to give in when a craving hits him. I think truckers, carpenters, general contractors, roofers, these are professions where smoking is fairly high, and it makes it just a little bit more challenging for him to quit. So I would try to have that conversation with him a little bit and talk to him about his environment, as well as, what would be improved in his life by quitting.
Mm-hmm. Yes, those are great ideas. To add to that, yeah. Sorry.
All great comments. This is Steve again. I think for as long as he smoked, as much as he smoked, I would add an oral medication, probably varenicline, in addition to the NRT, because I think his chances of quitting with NRT and counseling are probably not that great.
Mm-hmm. Yes, and he divorced, no children, to answer the question over here. He's divorced with no children, lives with a roommate, and she hit it on the head where he smokes with his coworkers all the time. So, yes.
Yeah, that's great. Good discussion. So, varenicline as maybe the first option if it's available somehow. I don't know if you guys have 430B pharmacy or other pharmacy options available for uninsured people. If not bupropion, well, neither, I'm not sure the cost around that, but either one. It sounds like oral medication plus nicotine replacement, which would include a long-acting nicotine replacement and then something short-acting as well, given his history. I wanted to make sure you captured that. That'll all be in the notes. We'll send you notes too, Tiffany. But for everybody, it's a good learning point to make sure you're kind of covering the bases there. It looks like, oh, thank you, Kara. So Florida Quitline has combination NRT therapy benefit starter kit, which is great, and as well as those classes, which might be helpful if he's interested in that kind of group counseling part of things as well. So some great ideas. Anybody else, Amy or anybody else, have any ideas or thoughts that they wanted to share?
I mean, I don't really necessarily have anything else new than what we talked about. I think it's really great to emphasize the counseling and medication. Within counseling, probably going to have more than one agent, so definitely varenicline with NRT is a good option. And then just the counseling component, letting him know that if he quits or is working towards quitting, he's going to have to establish a new routine as a non-smoker, especially since he's been smoking so long. So to really get help in doing that from experts from the Quitline, or if there are other counselors available, but just to use those two, counseling and medications, together, coming at this initially with that sensitivity around this topic, kind of the unknown of a potential cancer diagnosis, a health scare, of course, but then providing that strong advice to quit, and that this can be really serious and we want to prevent any future issues, and just making him know that you support him, want to help. So really everything that's already been said, but yeah, lots of good points.
Great, thanks, Amy. And thanks, Tiffany. This is a great case. I'm so happy that this patient found you. That he has a place for care and can have a regular follow-up, and that he's on your kind of, I used to call it my TLC list. Needs a little extra attention, make sure we capture him and get him some regular follow-up and ongoing care. So feel free to bring this case back, try a few things, come back to us and tell us all the new challenges that you're facing, and we are happy to help problem solve together too.